Welcome to today's special interview session on the topic of health issue related to endocrine and hormone system. So, let us introduce ourselves first. My name is Cik Farah Alia binti Cik Wan Maudin.
My name is Nur Safia binti Syarul Rizal.
My name is Faiz Deni bin Azli.
So, we are honored to have Dr. Nur Izzati Mustafa, a medical doctor from Hospital Sungai Buloh with us. Thank you for joining us, Dr. Izzati.
Thank you for having me.
Okay, so we would like to ask several issues regarding health concerns, specifically regarding the endocrine system that is affecting Malaysians daily. So the first question is, does Malaysians' diet and daily lifestyle impact their endocrine health?
Okay, so yes, the typical Malaysian diet is, as we know, high in refined carbohydrate, sugar, and fats. Okay, so also a lot of us have a sedentary lifestyle, and we have inactivity and stress. So all of this could significantly lead to development of endocrine disorder. So, for example, we start with the dietary influence on endocrine health. So, as you know, in Malaysia, we have our food is very, very high in carbohydrate, sugar, fats. We eat nasi lemak, roti canai, we drink teh tarik, kopi ice, Milo ice, right? So all this contributes to the development of endocrine disorder. So, for example, when you have high refined carbohydrate and sugar intake, this will lead to insulin resistance. So when you have insulin resistance, this will increase the risk of type 2 diabetes, metabolic syndrome, and could also cause PCOS, which is polycystic ovarian syndrome. Yeah? And then when you have high fat and calorie food, when you consume a lot of this calorie dense food, this will lead to obesity. So when you have obesity, this will actually disrupt the hormone signaling, and this will also increase the risk of getting conditions related to endocrine, such as the PCOS and also thyroid dysfunction. And also, we know that sometimes we don't eat enough vegetables. So when you have a low fiber intake, this could activate glucose intolerance, and this will also raise the risk of type 2 diabetes. And now we move on to the lifestyle, okay? As I said earlier, we might have sedentary lifestyle, which means that we only do desk jobs, we don't exercise enough, so we have low physical activity. So all of this can lead to decrease in the insulin sensitivity. And when you have that, and also increase obesity risk, this will also lead to increase of diabetic mellitus, so type 2 diabetes, okay? So and also you can have stress and sleep disturbance, okay? So when you work a lot, you have chronic stress, and then you have poor sleep patterns. This also will elevate your cortisol levels, which is a hormone, and also promote fat accumulation and also hormone imbalance. So to summarize, so endocrine disorders are linked to diet and lifestyle in Malaysia, and the common issues include the type 2 diabetes, PCOS, metabolic syndrome, thyroid dysfunction, and could also lead to non-alcoholic fatty liver disease, which is all exacerbated by the dietary habit and your lifestyle choices. Okay?
Okay, that's very insightful. Now, for the next question, I would like to ask, how does transfusion-dependent thalassemia cause endocrine disorders and complications, and how do we lower the risk of these complications?
Okay, so transfusion-dependent thalassemia, or we also call that TDT, right? So this can lead to various endocrine complications, primarily due to chronic iron overload. So why do you get chronic iron overload? Because you have frequent blood transfusions, okay? So when you have frequent blood transfusion, and which causes the iron overload, it will damage the endocrine gland. And then this will result in hormone imbalances and also associated clinical symptoms. So what are the complications, the endocrine complications from TDT? You can have hypogonadism, growth hormone deficiency, hypothyroidism, type 2 diabetes mellitus, hypoparathyroidism, and also adrenal insufficiency. So all of these conditions arise from the deposition of the iron in the specific glands, okay? So this leads to impaired hormone production, and also you get various clinical signs such as delayed puberty, fatigue, muscle cramps, and also others, okay? So what is the pathophysiology? So when you have regular blood transfusion, this will introduce excess iron into the body. As I said earlier, it accumulates in all the vital organs, especially the hormonal organs. So including the liver, heart, and of course the endocrine gland. So all these accumulation cause oxidative stress. And when you have oxidative stress, you'll have cellular damage. When you have cellular damage, you further impair the hormone secretion. So that's how it causes complications, okay? So what can we do to reduce the complications? So to reduce the risk of endocrine complications, we can do iron chelation therapy. So you give some drugs that can cause iron chelation and to help with the symptoms. And you can also have regular endocrine monitoring for the patient, and also maybe hormone replacement therapy. And of course, we will tell the patient to have lifestyle modifications. Okay, these are recommended. And so all these strategies aim is to manage the iron levels and also monitor the hormone function effectively. Okay.
Wow, that sounds crucial. So move to our last question, which is, what are the primary hormonal imbalance observed in Malaysian women with PCOS, and how do these imbalance contribute to the development of the syndrome?
Okay. So, polycystic ovarian syndrome, or PCOS, is a prevalent endocrine disorder in Malaysian women. Okay. Quite a few Malaysian women has it, and this is characterized by hormonal imbalances, primarily due to the elevated luteinizing hormone, or called LH, and also the androgens, which is the male hormones, and also insulin resistance. So what this hormone does is, you will have, when you have PCOS, these hormonal disruptions will have hypothalamic pituitary ovarian axis. So when you have disruption in this axis, you will have symptoms such as an ovulation, meaning that you do not ovulate, so you do not get your menses, and you can also get irregular menses. Okay? Hirsutism, meaning that you have a lot of hair for women, and also you can also get metabolic risks such as type 2 diabetes. So like the PCOS, the polycystic ovary, basically immature follicles which accumulate in the ovaries. Okay, so this is due to the hormonal imbalances that I've talked about earlier. Okay, so how do you manage the symptom? So you need to do some lifestyle modifications, and of course you need to have hormonal therapies, and also insulin sensitizing agents can be used to mitigate the long-term complications.
Thank you, Doctor, for this some good valuable information. So before we end, do you have any final advice for us?
Final advice would be, we do know that having a good lifestyle is very important. Healthy lifestyle is very important. Not for just endocrine health, right? So it's for our wholesome life, basically. So the point of being course is that we all have to have a healthy lifestyle for us to be able to be healthy. So therefore, make sure all of us have a healthy lifestyle so that we do not have to go through all these complications of lifestyle that is unhealthy. Okay?
That is excellent advice, Dr. Izzatin. Thank you for your time and for sharing valuable information with us today.
And that wraps up our interview today regarding the endocrine system. Thank you.
Okay, thank you very much for having me. Okay, good luck in your studies.